Good morning and welcome to my COVID-19 World Update. It's June 21st, 2020. My information is below. I'm going to get right into the data. Here we have Arizona in the United States. A couple of things that become pretty clear right away is that the majority of the cases in Arizona are in the Phoenix area. There's also some real trouble in the Idaho Nation in northeast Arizona. The death rates there are not good. A lot of associated comorbidities, I imagine, but the most dramatic thing for this is you can see that up until the end of May, Arizona was kind of going on the line like that. Increasing. So even then it wasn't good, but along about the 20th, 21st of May, sometime around Memorial Day, it really took a turn, and they're going up quite fast, especially if you think of this in terms of the population of Arizona and the case numbers that you're looking for. You know, that peak of 2,500 new cases in a day is pretty drastic for a state the size of Arizona. This next slide is the hospitalizations in Arizona, and you can see that same trend where you've been going across like this, but if you look from May 20th going on, it goes like that. Many times this data that's at the end, it just hasn't gotten the updates through into the system. So, and then we have some information by race and ethnicity in Arizona as far as who has the cases. This is Florida's data dashboard. I'm going to move me. Florida's data dashboard, and what I'm looking at more than anything here is that if you take a look at what the trend has been, you know, starting, this is the last 30 days trend, but looking at just the recent trend, a little bit more concerning. So if these last few days of new cases being reported continues, that's not good news. There is good news on the deaths, which we've also seen in other states, that they are tending to go downward over time. Next up is South Carolina, and I'm pulling these directly from the state's health department website where possible. So many times the data is not presented in a way that would be convenient to me. For a long time, they had a curve like that, which is not a bad thing. You know, if you've got your daily cases in a fairly flat curve, that's an excellent thing. But over the past 20 days or so, they've also seen their daily case rates really start to climb, and that's of concern. They need to do something there in order to get that to calm. We'll talk a little bit about what can be done later on. This one's also South Carolina, and you know, you've heard like the Florida governor the other day said that the increased cases in Florida was due to increased testing among migrant farm workers, and so he attributed it to increased testing. I don't have this same chart for Florida, but South Carolina and Florida border each other and have close ties, so it wouldn't surprise me if it looks pretty similar for Florida. So this is percent positive of the tests over the last 28 days in South Carolina. Great graph, because what this shows is, since it is a percent positive of the total tests taken, and the percent positive is increasing, then that means that what the incidence of the disease in the population is increasing. It's not just due to more testing. You're actually getting more positives as you test. Here we have the Texas dashboard, and very clearly you can see in Texas that we've gone from, what is that, the beginning of April, where we had a line like that. And if I take just the last 6 data points here, we actually then end up with a slope like that. Yeah, that was a little bit steep, but something like that. that. So that's of concern. When you compare the daily new to the cumulative, on the daily new cases, that's what they call what people refer to as flattening the curve. What matters is the slope of the line where you're at. So if in the last 6 days you're sloping upward, that's a bad thing. You can see that bear out also in the daily reported cases that it's definitely on the upswing. Texas hasn't been nearly as badly affected as New York, for example, but it looks like they're going to get their turn. It's definitely headed in that direction. This is state of Oklahoma. Trend line, I'm okay with that purple trend line, though I think if I were to draw it, I'd draw it more like that, something like that. But Oklahoma's worrisome. It'll be interesting to see after the Trump rally whether we get an even higher increased spike from that, from people who either don't typically run temperatures but may be otherwise symptomatic. I'm one of those. Things like that. And then again, you can see that same thing on the cumulative cases where you've got a curve like that, and then recently it's been more like that. That's definitely of concern. Going to Georgia, you can see in Georgia, the great preponderance of the cases are centered around the Atlanta area. And then in cases over time, we're marching along pretty smoothly as far as keeping the R0 value to a 1-to-1 ratio. There up until about the, what does it look like, 27th of May or so. And then it does seem to be taking an upturn as well there. And that's of concern. And that, 27th of May, that'd be, 5 or so days after Memorial Day weekend. And it'll be interesting to see what happens with the data as we roll forward, as we get weeks on from the big protests that happen. And Georgia especially was one of the places where you saw a lot of the protesters not wearing masks. So that's going to be a problem. This is the state of New York, and I'm putting this here to take a look at the curve in New York for daily new cases. Very encouraging. They've obviously done a really good job with that. You see the videos on the news of young people out in the streets, at the bars, crowded around each other, no masks, and that's in the last couple of weeks. And then they had pretty significant protests in New York as well. But thus far, short term, because that line there is June 5th, short term looks flat. And that's a great thing. We'll see if that continues going forward. I'm going to switch to a small state. This is the state of Idaho. And Idaho has been, I'm going to say unaffected, because one of the first hot spots in the country was in Sun Valley, Idaho, attributed to it's a pretty nice vacation destination, and a lot of people with a good amount of money have vacation homes there. So it's sort of a mecca for the rich and famous. Beautiful spot. So I can totally understand it. And that was this spike here early on in the outbreak. Seems to have gotten controlled, and Idaho was puttering along pretty nicely. But you can definitely see that in the last couple of weeks, as they've opened up, the trend is heading up again. And if you look at the slope of the cumulative cases line, that's definitely not a good thing. Now, Idaho is a small state. It's 1.5, 2 million people total. So 4,000 cases statewide is not a big deal. But it can become that if things don't get controlled. I know that people there don't wear masks in public very much. It's, badge of honor, I think, which seems kind of ridiculous to me. And neighboring Utah, Utah is following on their path, aligned a little bit more similar to more populous states. where they were running along pretty good, and you can see during the closure that the cases per day were staying pretty well in line. But again, it all got relaxed. People stopped self-isolating, and now you've definitely got a trend line that's heading up significantly. So that's worrisome. This is just another view of Utah that has the cumulative case total, and this one, you can see that was a little bit steep, like that versus that, so you can definitely see that the trend line is heading up. This is the California COVID dashboard. It's not one of my favorites, just because the charts are kind of wonky. This bottom one is deaths per day, which is holding steady, so that's a good thing that deaths per day are holding steady, where cases per day are increasing. You could almost point to a little spike up there, but I'm not sure I'm going to stick with that yet. We'll have to see going forward in the next week. This one is just LA County, and in LA County, you can definitely see that there was an upturn in cases right around May 21st, 22nd. That's Memorial Day weekend. I think that's the weekend people started going back to the beaches, but I can't really see a short-term spike here. So that's good. It definitely took a bump up in the number of cases that are circulating, but Governor Newsom last week mandated mask wearing in public spaces where you can't be socially distanced well, and I think that's a great thing. I really wish government would do that all over the place. I understand the Bill of Rights, but everybody has a right to life, including those who have comorbidities or comorbidity factors, who are at risk if everybody else doesn't wear a mask. So I congratulate Gavin Newsom. He's done a great job on this so far. This is San Francisco. I put this in here as well, just because San Francisco and Los Angeles were two of the places that had some pretty significant protests, like really big crowds in the streets. And thus far, their curve does not seem to be taking off. If anything, there's, I'm not going to call it short-term flattening, because this data at the end is, question according to how long it takes for the news to come through the pipeline. Cumulative deaths, unfortunately, though, I've shown you a number of charts where cumulative deaths were holding flat going across, but in city and county of San Francisco, it does appear that they are incrementing, albeit slowly. So this one I found at a site called Wear Mask to Save Lives. I found it pretty interesting just because it's a visual representation of the progress of the disease in populations according to cultural norms. So it's got the countries where it's not abnormal at all to wear a mask in public, and how they've done relative to those countries where it is abnormal or looked at as funny or strange or what are you, crazy, that type of thing. So the Western countries could learn a few things from the Asian countries with regard to this. There's no shame in wearing a mask in public. It protects others. So, if you care about killing somebody, wear a mask, because you don't know if you're infected. The only way to know is if you get severe symptoms, and by the time you get severe symptoms with no mask on, you've already infected somebody. So wear a mask in public, protect other people, don't be selfish. And finally today, to the Our World in Data website, just a quick overview of how things are progressing in countries. This chart is confirmed cases new per day per million people. I like to use the per million rather than a raw number, because that gives me a comparison between the countries. And currently per million new cases per day. Chile is in the lead. So it's growing at a faster rate among the citizenry of Chile than any place else. Yeah, you'll notice this big spike here that we had. I spoke to that a tiny bit yesterday, but it seems to have corrected. So that must have been something perhaps cases from these 2 days that were still coming through the pipeline. But definitely on an uptrend there. Brazil is on an uptrend that continues. The United States is on a significant uptrend. If you look at that, that's 1, 2, 3, 4, 5, 6, a line of 7 in a row heading upward. So we should be concerned in the United States. South Africa is on a definite uptrend as well. So it's an area of concern. Mexico had been on a pretty decent uptrend, but we'll see if that downward continues. Maybe they've started to get serious about their mitigation efforts there. UK is on a long-term downward trend over the last 30 days. Hopefully that'll continue and the protests in the streets haven't infected more people. India's on a long-term uptrend, and if you think of cases per million people, India ends up way down here on the graph, but think about how many people there are in India. There's a lot of cases going on in India, and there's unfortunately going to be many deaths. Canada seems to be on a long-term downward trend, and we'll hope that that continues as they continue their mitigation efforts. Canada's been pretty strong on that. France is in a short-term uptrend, and that could also be from the protests that were happening in the early parts of June. We'll see if that continues going forward. And Germany shows the same, could be for the same reason, or it could just be because they were opening things up. The other thing that I wanted to show you here on this one is cumulative deaths per million. Now this is one of the ways that you can measure the effects of one outbreak versus another. I normally look at it, and I'm accustomed to seeing it in deaths per 100,000 people, but it's easy enough. If you take these, you can remove a 0 and then you're there at the same number. For example, when I was taking a really close look at Italy a while back, I was finding that in the study that had been done on the influenza virus, a really bad year of influenza virus in Italy was 40 deaths per 100,000 people. That was a bad flu year. So, and flu is a pretty bad infectious disease, especially for people, the elderly and people with factors that contribute to morbidity. So if we take a look at this, we can actually bring up a list of what those values are for each country in descending order, so for the countries on this chart. And so you can see that the UK, as it stands right now, is 622 deaths per million. So they're the world leaders, so to speak, which is not a very great thing to have attributed to you. But if you did that in deaths per 100,000, then it would be 62 deaths per 100,000. So it's about 50% higher than that example of a bad flu year that I gave you in Italy, right? And Italy's a country that gets affected pretty badly by the flu because of their elderly population. France is right around 45 per 100,000. The U.S. is at 35 per 100,000, so it's a really bad flu year in the U.S. right now. And I'm just showing you this to kind of put things in perspective. We're 3 or 4 months into this so far, and at this point, the death rate is a really, really bad flu year. If we keep it under control, we can get through it. But if we let it get out of control, it's going to get really, really bad. I know that's true. Thanks for watching. If you like this update, please subscribe. And as always, wash your hands, wear a face covering in public spaces. Please tell your friends to do the same. We can get through this, but we all have to work together.